Dear ladies and gentlemen, my name is Friedhelm Hummel. I'm the director of the DEFITEC Chair of Clinical Neuroengineering at EPFL, and I'm very pleased to present some aspects of our research work today. My lab is mainly interested in the understanding of neurological disorders like stroke, traumatic brain injury, or neurodegenerative disorders, and in developing and applying neurotechnologies to support these patients and their recovery process, with the goal to bring these interventions from bench to clinical bedside to the patients. Today I will present two of these approaches we are focusing on. One is on acquiring patient data remotely and to use computational approaches to analyze, to provide expert knowledge for personalized treatment. And the second part will be on an approach for enhancing functional recovery in stroke patients based on non-invasive neuromodulation of the brain. And also this is for home-based use planned. In 50% of world's population lives with a disability, especially in emergency situations such as during or after a conflict or a natural disaster. This additionally generates an increased number of people with disabilities, for example, with new injuries or subjects, patients who had already a disability, they have a lack of medical care and all the essential services. This results in significant social, economic, and healthcare problems because there is a clear loss of mobility, an increased rate of dependencies, and by this a loss of access to healthcare and essential services. And this impacts on economy and social factors like loss of income, loss of home, with the subsequent psychological factors which impact on the individual patients. And unfortunately, also disability results in high rate of abuse in emergency situations. So it's a clear need for improving this situation. Well, one of the major problems and challenging for these patients is the lack of access to healthcare systems. And you see here a current study from the Handicapped International, and the most important point which is mentioned by the patients is that they even don't have enough access to healthcare-related information about their disability, about their disorder. They do not have access to expert knowledge and treatment like you need for this trained staff and clinical medical expertise. And there is a clear lack of access to supportive diagnostic and treatment technologies. In general, in these environments, the support and rehabilitation for these patients relies to a large degree on relatives, on the family, but also on community without medical expertise. So now to improve this and to find solutions for this, we have to face a few main challenges of this. This is how do we provide expert knowledge remotely? How can we provide it in a personalized fashion to adjust this information, treatment suggestion to the individual needs of the patient? And then how do we bring the diagnostics, treatments to the patient instead of trying to bring a patient to a healthcare center which has the expertise, which is in such situations, like a pandemic situation now also, but in humanitarian situations quite difficult. So ideas of solution can be developed based on technology. So and the important point is, are we able to acquire disability-related information which we need to have a personalized decision-making, like for treatment? And then is it possible to bring the treatment and make it accessible and applicable in a home and community-based environment where we do not necessarily need physical supervision of a healthcare expert? And today I would like to present you two ideas in this direction where we're working on. So one idea is based on an app-based platform for personalized healthcare advice. So within this platform, we want to gather disability, disorder-related information from the patient, and based on this, using computational approaches, machine learning approaches, to provide to the patient suggestions, for example, for treatment, etc. And the second approach I would like to present today is an intervention based on non-invasive brain stimulation, which can be remotely controlled and applied in a home-based fashion where the patient, relatives, or local healthcare providers can provide to the patient this intervention. So for the first approach, I want to give you here just a general view on this. So the idea is that the patient provides this disability impairment related data to this platform, and within this platform this information will be used by computational approaches to provide then personalized, individualized information for the patient, therapy suggestions, but also suggestions, for example, in everyday life. So let me go there a bit more in detail. I don't want to go into the relative part today, but it's, the idea is also that relatives can access such an information. Okay, so in general, to be able to provide a personalized, individualized treatment suggestion, a healthcare expert need to evaluate the degree and the type of impairment or disability, and based on this, then the expert can decide on what treatment should be applied. And I have here two examples of two stroke patients. As you can see, this patient have kind of different problems than the other patient who can move pretty well the arm, but this one has really difficult to open hand. So these two situations, basically, the treatment selection would be differential, would be not the same for both patients. However, in situations like a pandemic, or even more pronounced in humanitarian difficult situations like like conflicts, etc., there this healthcare experts will be not accessible. So the question is, can we replace basically the evaluation, the scoring of the patient by technology? And I want to show you one idea, one approach. One of my PhD students, Pablo Mesera, is currently following up. So the idea is to use technological approaches like inertial measurement units, as you can see here in these videos. They are quite simple, relatively cost-effective, quite simple to mount and to apply. And then to the patient, the video is shown what movements the patient has to do. He sees here the video, and he has to, or she has to follow up basically these movement, and then it's recorded by the two IMUs, the movements. And then based on computational approaches, features can be extracted from this information and try to be used to reproduce the impairment, to define the impairment of the individual patient. Additionally, Pablo is also using videos and by basically analyzing by deep neural network approaches, for example, deep lab cut, to analyze again here the movements of a person or a patient, extract also here features which determine these movements, and on this basis then to try to reconstruct the impairment of the patient, as you can see here. So video features, IMU features will be fed to a classifier. This classifier will allow to clinically score the patient, and then based on the clinical scoring, patients can be stratified in different groups of impairment, and then based on the different groups of impairments, a personalized treatment strategy can be selected and can be advised to the individual patient. So this will allow that even in a remote way, we can analyze patients' impairments and can dedicate the treatment. So the second part now, the last few minutes of my presentation, I will show you one approach, how probably these type of treatments can be applied in a home-based fashion. So what is important, and again, I'm talking today about stroke recovery. What are the essentials for stroke rehabilitation? One is in rehabilitation that the lost skills are retrained. So training is a very important feature. And the second point for functional recovery after a stroke are the neuroplastic abilities of the brain, so that it can reorganize and re-implement basically these features. So the open question then is there any means that we can enhance these factors? And in the last 10-15 years, evidence was acquired that cognitive functions, motor functions, and learning can be enhanced by neuromodulators. And one of these we're interested in is non-invasive brain stimulation. And we use electric stimulation of the brain to achieve these. And I want to give you one example in a study we currently performed in healthy old subjects. So the subjects received electrical stimulation basically, and we trained them for 5 days and were interested how much they improved in their learning capabilities over these few days. And they had to train basically a piano sequence. And if you see the improvement here with placebo stimulation, you see that the healthy old subjects improve over time, and even 60 days after the training, there's still an improvement. However, If you combine this training with real brain stimulation, then the improvement is much, much steeper over time, and even still after 60 days, there's a significant difference between the two groups, suggesting that non-invasive brain stimulation can enhance neuroplasticity and can enhance the abilities to learn a new skill. So, and furthermore, it has been also shown by us and others that stroke recovery can be also enhanced by non-invasive brain stimulation in patients. However, the problem of all of these approaches so far applied is that they are applied in either a lab environment or a clinical environment. However, if we go back to our initial ideas that applying such treatments in a humanitarian difficult situation or in a pandemic situation like now, these applications should be developed that they can be applied in a safe way, remotely controlled way, at home by the patients themselves. And we are currently running studies to test this in healthy subjects, in stroke patients and in the patients with depression. And the general concept is that the mounting of the device, like the electrodes, that it has to be simplified here. It's easily done, can be done by the patients or subjects themselves. It's remotely controlled, so the parameters of stimulation cannot be changed by the subject, but only by the expert who is controlling the device. And all the information during the stimulation or from behavior will be sent back basically to the supervisors, if you want, or the experts. So this is an approach which then can be applied in different setups for patients who are not so severely impaired or patients who are much more severely impaired and do a different training. So with this, we are pretty optimistic that these treatments can be brought in a safe and remotely controlled way home to the patients or to the community without the supervision of a healthcare expert, but probably a non-expert. Okay, let me summarize. I think in humanitarian situations, it's very clear that there's a strong lack of access to health information, expert knowledge, treatment, and healthcare for people with disabilities. And these features need to be provided to the patient because otherwise there's a strong impact on daily life, economics, and social interactions. I think technologies might offer a promising opportunity to provide the expert knowledge in a remotely way, to access remotely the patient information. This will lead to give advice for personalized treatment in a home community-based fashion, even self-application. And this will also strongly support local non-expert healthcare providers like the relatives or community-driven, for example, nurses. And such an approach is especially suited for patients who have chronic disabilities where the support needs to be done over weeks, months, probably years. And this will lead to better access to needed healthcare and treatment, better long-term functional outcome and recovery, a better reintegration in social and professional lives. It will support the relatives and local healthcare providers, will help them. And by all of these factors will definitely also reduce the psychological impairment for the patients. And I showed you today an application for a stroke patient. However, I think by changing the content, this general concept is scalable and can be applied also in other disorders like dementia, traumatic brain injury, or PTSD. Thanks a lot for your attention, and especially thanks a lot to the team and all the funders who helped us to do this research.